Bulbinaka everyone. I'll give my initial speech and then I'll ask Tok and then I'll ask Alicia again, as usual, to go through some of the data that we have. So we've run about 828 tests yesterday, and we have one positive result. This is a new locally transmitted case of COVID-19. The patient is the 14-year-old daughter of the hotel staff, who was the central focus of our contact tracing. This daughter did travel with her mom to the funeral at Tavakumbu on April 16th and 17th. However, she had no symptoms and she tested negative when she entered quarantine on Sunday, April 18th. And now she has tested positive on day 4 of quarantine. This indicates that she entered into quarantine before she became infectious. Let me explain. We know that this virus has an incubation period of up to 14 days. So the person may take up to 14 days to have enough virus in their body to either develop symptoms or trigger a positive result. Importantly, the level of virus becomes detectable on a test where the level of virus only becomes detectable when it becomes detectable on the test. It also relates to how infectious that person is at that time. If someone has no symptoms and tests negative in the community, it is unlikely that they are infectious, even if they later become positive while they are in the quarantine period or while they are held in quarantine. So now we have 6 locally transmitted cases that can be traced back to the soldier who caught the virus while working in the border quarantine facility. 3 of these latest local cases were not infectious while they were in the community. We know this because they had no symptoms at the time and were negative in the first test when they were entered into quarantine. It is only on the second test in quarantine that they tested positive. Apart from the 6 locally transmitted cases, we have 14 border quarantine cases. So now we have 20 active cases in isolation. Our teams across Vitilevu have told us they're seeing a notable increase in mask wearing among members of the public. This is great news. And it means a great deal to us at the ministry to see so many Fijians share our mission to keep Fiji safe. Our masks, when we wear them properly, are badges of compassion and concern for those around us. Homemade or store-bought wearing masks lets our doctors, nurses, lab technicians, and members of our discipline forces all know that through the long days and sleepless nights, we are not alone in our work to stop the spread of COVID-19. The nation is with us. You are with us. And together, we will defeat this virus. Remember the guidance that we had announced and published about homemade masks? It requires at least 2 layers of cloth for these masks to offer protection. We announced that before, and I have to remind everyone again. Some people have been asking about mask wearing in their own personal vehicles. If you are alone in your personal vehicle or with other members of your household, you don't need to wear a mask. But when you exit the vehicle, please place one on. There is a nationwide curfew between 11 p.m. and 4 a.m. every day or every night. As announced yesterday, we are asking for restricted movement outside of the curfew hours from 7 p.m. tonight until 11 p.m. on Sunday evening. That means everyone should stay at home and only spend time with members of the family. To us, it's important that you do that, because my teams are going to use that window to conduct health screenings in targeted regions throughout Viti Levu. Health officials will also be checking Fijians for COVID-like symptoms and making sure that they had not had contact with someone who was contagious with the virus. During this period of restricted movement, businesses such as supermarkets and pharmacies may open at the discretion of their management. Public transportation may run with mask wearing enforced. No other workplaces should open. So, except for shopping for food or medicine or traveling for medical emergency, there is no other reason to leave your home. If you're out and about without an essential reason, the police will ask you to go back to where you reside. As we've seen before, this brand of early, decisive action is key to saving lives. But it only works when the public works with us. So please, stay home as much as possible. Again, please remember that the normal curfew hours from 11 p.m. to 4 a.m. is still in effect. As I've said before, these protocols, if these protocols are not followed, then I will have to recommend lockdown measures for entire towns and cities. I also want to remind us that there are many unknowns to determine for us to get clarity on. These unknowns will determine how long the rest of our health restrictions will remain in place. More tests must be run. More time must be given to confirm that the virus is not lurking in some communities. If the numbers point to a wider outbreak, we won't hesitate to escalate our response. But what we do know is that by staying home, you give us a much better chance of stopping the spread. If you're watching this from home, wonderful. If you aren't, please start making your arrangements to go home soon. We're urging businesses to close up shop well before 7 p.m. so that staff and customers have time to head home. And remember, if you're heading home using public transport, wear a mask and wear it properly. The members of the media here today and around the country have a special responsibility in carrying these messages to the public. I hope the media has taken note by now. Reporting the facts is more important than reporting first. When you're in this briefing, I request that you listen carefully to what I'm saying. Our strategy is based on science. What we're trying to do is carefully harness the resources at our disposal and target them where it makes the biggest difference. So if you have a question to ask, sure, you ask it, I'll answer it. But to a large extent, please don't put words in my mouth or ask me what you wish I had said. So, because all this sometimes can confuse some of our people out in the community. I was a bit disturbed by a couple of tweets that went out from one reporter yesterday. Some incorrect tweet posting that Fiji will be under nationwide nationwide curfew starting tonight, 7 p.m. That was wrong. I have to thank the reporter for removing the tweet. I think she did an honorable job there. She also posted an apology, which was really good. However, it also stated that police would arrest people who are out without any essential reason. I need to correct that, because during the window of restricted movement, the Fiji police will be asking, encouraging, and persuading people to stay home. That's how we have discussed this plan this morning. That's what we want you to do. We want you to willingly stay home. I know that as a nation we can rise to meet this challenge. Most of us are abiding by the protocols we have in place. The vast majority of Fijians are doing the right things. But unfortunately, we do have a few instances of rule breaking. Apparently, after we established Moturiki as a screening zone, one particular gentleman was picked up in Overlau after he swam across the channel. He's with the police now. He won't be swimming for the next 14 days until he's cleared from the screening zone. Some of you might find this a bit funny, but I highlight it because it is a real problem for us. You know, when somebody breaches some of the screening zones that we have to send a huge number of people to go and investigate that breach. And sometimes the breach is a real low-risk breach. We could have used them somewhere else. But because it happened, we have to investigate. The nature of this pandemic can induce anxiety in a lot of people. It is a scary time. But don't let fear drive you towards making bad decisions. I want everyone watching to know, if my team is in your community, they are there because they care. They care about you, they care about your family, they care about keeping our country safe. So please, just offer whatever cooperation and assistance you can. Today, I was sent some awesome photos of food items donated by Mr. Billy Singh of Kundan Singh. It was delivered to the families within the screening zone at Wainitaro settlement. Hotels like the Tanoa and Crow's Nest have supported our surgical teams working in Singatoka and Rekereki. The Holiday Inn has helped provide meals and catered for our health officials. I want to thank Women in Business and the Fiji Chamber of Commerce and Industry for reaching out to their members and to other businesses to adhere to our health protocols. I make special mention again of Tanoa Hotel. They have been with us from the very beginning and they have supported us in many different ways. I hope to see other business organizations set up do the same also. There are other operators out there aiding us at every turn. And across the country, small gestures of solidarity is taking place every day, most of which will occur without much fanfare. Big or small, there is something all of us can do to ease the burden of this outbreak on those who are worst affected. This has to be a national team effort. We are all working to overcome the same mountain of adversity for the benefit of every family, every business, every industry, as well as the Fijian economy. So if you're a business and you know of some way you can help us, please call 158. As I've announced, we are deploying COVID-19 vaccines to be targeted groups in the West and in Suva. As of this morning, we began administering vaccines to parliamentary staff and members of parliament. Members of the media as well were asked to come forward, and some of them came and got vaccinated this morning. I hope that by this time next week, you'll be joining us in receiving your first dose if you haven't got it. To the rest of Fiji, stay safe, stay home. And if you have an essential reason to leave the house, mask up. Thank you.